Thanks for joining us here on 9 News Plus. I'm Chris Bianchi, and today we're going to chat about health navigators. And if you've not heard of a health navigator yet, you're not alone. And we're here to explain what they are and how they can help you. And joining us to do this in both English as well as in Spanish is Yvette Camarena, a Colorado-based health navigation specialist for the Colorado Department of Public Health and Environment. But as usual with our segments here, we often start in Spanish, and we will do so today. So I'm going to flip things over to Spanish if you're joining us in English, and we'll start up again in English in about 5 or 6 minutes. Hola y buenas tardes a todos, soy Chris Bianchi y hoy vamos a hablar sobre navegadores de salud. Y si no sabe qué es un navegador de salud, no se preocupe, estamos aquí para explicarte qué son y cómo pueden ayudarse. Entonces, por eso para hablarnos sobre el tema, me acompaña Yvette Camarena, especialista de navegadores de salud del Departamento de Salud y Medio Ambiente de Colorado. Yvette, gracias por estar con nosotros hoy. Buenas tardes.
Muchas gracias, muchas gracias.
Bueno, Yvette, quiero empezar con la pregunta más obvia, yo creo. ¿Qué es un navegador de salud?
Sí, un navegador de salud ayuda a entender el complejo sistema de cuidado de salud en este país. Los navegadores trabajan directamente con personas para ayudar a superar barreras de salud en cuidado médico, incluyendo los que tienen seguro médico o no tienen seguro médico, o otras barreras como transporte, cuidado de niños y mucho más.
Y ¿por qué los navegadores de salud son importantes?
Los navegadores son importantes porque, perdón.
Está bien. Sí, puedes explicarnos por qué son importantes.
Sí. Los navegadores son importantes porque trabajan directamente con sus pacientes y hacen relaciones con los pacientes en que trabajan. Les ayudan a hacer citas, transporte y conectar a los pacientes con los recursos que hay disponibles. Los pacientes se sienten cómodos con los navegadores de salud y les dan apoyo.
Y también, Yvette, ¿cómo una persona puede contactar a un navegador de salud? ¿Cómo empezaremos ese proceso?
Sí, pues muchos navegadores de salud trabajan dentro de sus cuidados médicos o los centros de salud comunitarios y agencias de salud pública.
Bueno, gracias por eso. Y también, ¿qué es lo que ha hecho el Departamento de Salud para aumentar el número de navegadores de salud en el estado de Colorado específicamente?
Desde 2013, el departamento invirtió más de 32 millones de subsidios en parte de los servicios y entrenamientos de navegación de salud. Los subsidios ayudaron a los navegadores en muchas comunidades en el estado para prevenir y tratar enfermedades crónicas como diabetes, enfermedad del corazón y cáncer. En 2015, el departamento y socios comunitarios empezaron la iniciativa de navegadores de salud en Colorado para tener habilidades en un esfuerzo para que los empleados puedan hacer una fuerza laboral de navegación en Colorado. El departamento también creó una lista de navegadores en Colorado que han tomado el entrenamiento y el examen. Esta lista está disponible en la página del departamento.
Bueno, muchas gracias, Yvette, por todo eso. Y eso concluye la parte en español de nuestro programa. Y ahora seguiremos en inglés. Yvette, now as we switch things over to English, I think the first question I asked you in Spanish, and that I'll ask you now, is if you could start off by, I suppose that the most obvious question here is, what exactly is a health navigator?
Yeah, a health navigator, or also known as a patient navigator or lay navigator, is a trained member of a healthcare team who helps patients identify and reduce barriers and navigate the complex healthcare system. Health navigators initially worked with cancer patients, but today they work in all different forms of hospitals, community health centers, private practices, and other agencies, assisting individuals across the continuum of care from prevention to end of life.
And Yvette, suppose you explained a little bit within what you just said a second ago, but could you explain to us why health navigators are so important?
Yeah, health navigators are important because they build trusting relationships with their patients. They help them make, keep, and prepare for appointments, arrange transportation, translation services, link patients and families to community resources, coordinate care across different healthcare providers, and support and encourage their patients.
Well, certainly useful information there. And could you explain to us how to get in touch, how to begin the process of getting in touch with a health navigator?
Yeah, so a lot of navigators, as I mentioned, work within community health centers, private practices, and different hospital networks, safety net clinics. So they are locally around the state of Colorado.
So options there. And what is the Department of Public Health doing to try and increase the number of health navigators, specifically here in the state of Colorado?
Yes, we have the department has invested more than 32 million in grants that include health navigation training and services. These grants have funded health navigation in communities across the state to help patients prevent and treat chronic diseases like diabetes, heart disease, and cancer. The Department of Community Partners started the Health Navigator Workforce and Initiative in 2015 to standardize skills in an effort to help employers identify and develop a health navigator workforce in Colorado. The initiative surveyed healthcare employers, identified core competencies for navigators and established training standards.
And Yvette, one final question for you that just kind of came to mind for me is, are health navigators especially important for the bilingual community? Because you mentioned in those translation efforts, are health navigators geared towards or especially important for Spanish speakers or bilingual communities?
Yes, definitely. And I think mostly because they relate to those patients, especially if they speak their language, they're able to connect with them and really relate to what they're going through. And so I think patients really value that in a patient navigator, especially those, like I said, that have been kind of trained and they're really involved in working with their communities.
Well, this is all really, really helpful information, so that we really appreciate a few minutes of your time. And thanks so much for taking the time to join us here on 9 News Plus today.
Awesome. Thank you. I appreciate your time.
And thanks again, Yvette Camarena from Colorado's Department of Public Health and Environment, once again explaining what a health navigator is and why they're so important. Again, thanks for joining us here today.